you mentioned prediabetes. I would like to learn more about that, and I know you've gone over the values before, but let's go over them again. What are the values, the numbers from the testing that would indicate a person has prediabetes?
Mm-hmm. So prediabetes by the American Diabetes Association would be a fasting blood sugar between 100 and 125. Or they can do it based on a post-challenge. If they've had a glucose challenge with an oral glucose tolerance test, it would be between 140 and 199. Now that's based on the blood sugars. But we also think of prediabetes, or those at risk for developing diabetes, as those who may also have signs from the metabolic syndrome. And that's a constellation of excess body weight with large waistlines. This is the American Heart Association guidelines for the metabolic syndrome, or say prediabetes. Hypertension, high triglycerides, meaning fasting triglycerides over 150, healthy cholesterols for women less than 50, for men less than 40, and then impaired fast, which would be, again, fast between 100 and 125.
Okay, so if people meet any of those criteria for prediabetes, what does that mean for them in terms of what they need to do?
Mm-hmm. So there's accumulating evidence that patients who have prediabetes can have some of the very similar complications as patients who have established diabetes. Okay. So that means that they can have heart attacks or cardiovascular disease. They may also experience some of the problems that established patients with diabetes have with what we call microvascular disease or small vessel disease. They could have neuropathy, pain and discomfort in their lower extremities from nerve damage from high blood sugars, or problems with kidneys, the protein leakage in the urine that you might see. So those are some of the macrovascular complications that patients with prediabetes experience, just like patients with established diabetes.
Well, now, is it inevitable that someone who is found to have prediabetes will later develop diabetes?
It's not inevitable. There's been clinical studies showing that if people can institute a lifestyle changes, so for instance in the diabetes prevention program, exercising about 30 minutes a day, sort of brisk cardiovascular, brisk walking, 30 minutes a day, 5 days a week, they could significantly reduce their chance of developing diabetes within 3 to 4 years. It doesn't mean that they would never experience diabetes, but they could substantially reduce their risk if they adopted lifestyle changes.
All right. Would they need to pay attention to nutrition as well?
Yes, it would require change in nutrition and increased physical activity. So oftentimes it's paying attention to the calories, the quantity of calories, the types of foods that you're consuming, and then again, being more physically active.
Right. Are there any resources typically in a community where they could turn for more information, or also perhaps reliable websites they could turn to?
Mm-hmm. So websites, if available to them, is the WebMD, and also the American Diabetes Association has quite a bit. The American Heart Association as well has things related to this metabolic syndrome, cardiometabolic disease, where there's risk for diabetes. And then locally, the diabetes centers have resources with certified diabetes educators that typically will require their healthcare provider to make that referral.
Okay. But they may want to talk to their doctor about referral to local resources.
Mm-hmm. Yeah, absolutely. I would encourage that.